Hello, and welcome to the MMDP project webinar. Over the next hour, we will discuss a few exciting innovations related to trichiasis management. The webinar will include presentations on two topics. First, a Trichiasis Surgeon Trainer's Manual. The manual was recently developed to complement existing technical training materials used for surgeon training. And second, a trichiasis patient tracker application used to support the provision of services to individuals with trichiasis. My name is Whitney Goldman. I'm a Senior Program Manager on the Morbidity Management and Disability Prevention Project at Helen Keller International, and I have the pleasure to be moderating today's webinar. Thank you for taking the time to be with us today. To begin, we would like to introduce today's speakers and topics. For the first topic, a Trichiasis Surgeon Training Manual, we have the pleasure to welcome three speakers. Emily Gower, Associate Professor at the University of North Carolina at Chapel Hill, who will discuss the evolution in thinking and tools used in trichiasis surgeon training. Dr. Amir Bedri, Director of Eye Health and NTDs at Light for the World and a public health ophthalmology consultant, will present on the intended use of the manual. Finally, Sabrina Latour, Capacity Building and Technical Support Specialist with Helen Keller International, will present on the contents of the manual. We are also delighted to host a discussion on a mobile trichiasis patient tracker application. Sarah Bartlett, Technical Advisor MHealth for Neglected Tropical Diseases at Sightsavers, and Kim Jensen, Innovations Manager for Neglected Tropical Diseases, also with Sightsavers, will present an introduction and overview of the application. Before hearing from the speakers, let's run through a few key pieces of information regarding the webinar. You should hear the audio of the webinar through your computer speakers. If the audio on your computer is not working, you can call in using a telephone by following the instructions in the audio tab on the right-hand side of your screen. We welcome your questions, which can be sent throughout the webinar using the questions box. There is time set aside at the end of the webinar for all of the speakers to respond to your questions. A recording of the webinar will be made available for future playback. A link to the webinar, as well as the presentation, will be shared with participants via email following the close of the webinar. Finally, we would please ask that you take a few minutes to provide feedback following today's webinar through an auto-generated questionnaire. We look forward to hearing your thoughts regarding this webinar, as well as ideas for future topics that would be most useful to you. Today's webinar is hosted by the MMDP project, a 5-year USAID-funded project to strengthen the capacity of MMDP systems and scale-up implementation in select countries, as well as work in partnership with the global community to share knowledge and meet trachoma and lymphatic filariasis elimination goals. So with that brief introduction and without further ado, I will now pass the webinar over to Dr. Emily Gower.
Hello, everyone. Welcome to the webinar. We're pleased to have you here. I'm going to give you a brief overview of the rationale behind why the training manual has been developed. So over the past few years, there have been 2 global scientific meetings held that bring together trichiasis experts from a variety of fields to discuss evidence that has been accumulated since the launch of GET 2020. From both of the meetings that have happened in the past few years, the conclusions have been that in spite of great progress that has happened, the management of trichiasis is still low, so we're likely not going to meet the backlog goals by 2020 if we maintain our current standing. And second, that quality and outcomes are not always optimal. And these are summaries. The 2 reports on the right have summaries of this information that you can read in more detail. And hopefully the slide's going to advance here. Let's try again. Well, one more time. All right. So one of the goals for trachoma elimination is to reduce the rate of trichiasis below 0.2% in adults. And in order to achieve this, we must do more surgery and do it with better quality. The picture on the left shows, we've got two great surgeons working, but they're not using loupes and their mask is not covering their nose. So even in a setting where people are being closely monitored, often things like this have been falling through the cracks. So these are issues that we need to make sure that we address systematically as we move forward to reach our elimination goals. Research that has been conducted over the past 15 years has focused on evidence that we need to improve the surgical procedure, we need to improve training and supervision, and we need to improve service delivery and uptake. The focus of the manual that we're presenting today is the second of these, training and supervision. In many cases, we have found that post-operative trichiasis, formulation of granuloma, and cosmetic abnormalities such as eyelid contour abnormalities are most likely related to individual surgeon performance. And as a result, there is significant opportunity to improve outcomes by improving the training process. When we started looking at developing this training manual, we gathered information that was currently existing. First, the WHO Trichiasis Surgery Manual, often known as the Yellow Manual, and the Training of Trainers Manual. We also gathered the Final Assessment of Trichiasis Surgeon Guidelines, which used to be a standalone document, but are now incorporated within the Yellow Manual. And then finally, Head Start, which I will give you a brief overview momentarily. So what is Head Start? I'm sure many of you are familiar with Head Start. Head Start stands for Human Eyelid Analog Device for Surgical Training and Skills Reinforcement in Trachoma. The picture on the left shows the device itself. It consists of a reusable silicone base molded to the shape of a head, and disposable eyelid cartridges that mimic all of the key layers of the eyelid for performing trichiasis surgery. Head Start training as an individual component involves a roughly 3-hour session, one-on-one with a trainer and a trainee sitting together, going through the steps of the surgery individually and then putting it all together by the end of that 3-hour session. Research on Head Start has shown that one initial training session with Head Start reduces the number of trainer interventions during initial surgeries from 4.8 to 2.5. So this is roughly reducing the number of times that a serious error is made by 50%. It also reduces the time required to complete initial surgeries by about a third, moving it from 23 minutes versus 31 minutes for those who haven't had Head Start practice. And this increased speed continues after many surgeries. Use of Head Start as a refresher training tool, where you bring surgeons back to a training site who have already been certified or have been practicing trichiasis surgery for a long time, has shown the importance of refresher training. We conducted a study that evaluated 23 surgeons and found that 78% of them had unacceptable scores on at least one aspect of surgery prior to the refresher training. So they had significant improvement from using Head Start for a 2 to 3 hour period. Finally, we've just finished a study looking at long-term use of Head Start, where individuals practice weekly on the simulation device in areas where they have low volume or during periods where they have low volume, such as during the rainy season. We haven't analyzed these data in full yet, but the initial evidence suggests that all of the trainees really enjoyed this because it helped them to maintain their skills when they weren't performing surgery at a high volume. Some of the challenges that we found in training individuals are that often Head Start has been used as a standalone component for training surgeons, whereas we prefer that Head Start is conducted almost simultaneously with live training so that you move directly from the simulation training into the surgical theater within a few hours to a day after your training. We found that often there's a long lag time with individuals being trained on Head Start in 1 month and then it being several months before they practice on live patients. And finally, we found that retention of new skills and competencies is not maintained if trainees are not able to put them into practice immediately. So we have many settings where individuals have received trichiasis surgery training and then have been certified, but then haven't practiced for 6 months. And by the time they actually get out there to perform live surgeries on their own, they forget the steps of what they're supposed to do. So the solution that we've come up with was to consolidate all of the training materials into a single package that takes the learner through all of the steps, going from classroom theory to Head Start, followed by live surgery, and finally certification. And all of these steps are now provided in conjunction with the yellow manual in the manual shown here on the screen. So I will now hand it over to the team that's going to walk you through the new manual.
Thank you, Emily, for that helpful introduction and background. Now we'll hand it over to Dr. Amir Bedri and Sabrina Latour to discuss the training manual in more detail.
Thank you, Whitney. Hello, everyone. In addition to the training challenges already mentioned by Dr. Gower a few minutes ago, how TT surgery trainers conduct the training using the WHO Yellow Manual is also as variable as their background. The quality of the training procedure depends to a considerable extent not only on their surgical skills, but also on their experience in teaching and knowledge and application of adult learning principles. As you know, not all skilled clinicians necessarily make good teachers. Therefore, the main objectives of this training manual are to facilitate and standardize the process of how the training is conducted, to ensure similar level of quality of teaching and training across different trachoma endemic countries where TT is still a public health problem. It also guides the trainer how to prepare for and lead the different training activities. And above all, it provides a training package encompassing all relevant key technical resources available that are needed for successful training. The manual is intended for all trainers of TT surgeons who have to fulfill certain criteria for conducting successful training of TT surgeons. The trainers should be ophthalmologists or allied ophthalmic personnel, such as ophthalmic nurses or ophthalmic officers, with extensive experience in TT surgery and be currently actively practicing TT surgery. Being an ophthalmologist alone is not a guarantee for ensuring good quality TT surgery training. The trainers should have extensive experience in TT surgery technique or techniques being taught, be it the Trabu method or bilaminar tarsal rotation procedure. They should have previous experience in teaching and should be able to demonstrate good understanding of adult learning principles and good teaching skills to maximize the learning potential of trainees. They should be familiar with WHO Yellow Manual and have experience in using the final assessment of TT surgeons for certification, which is now part of the second edition of the Yellow Manual. Finally, they should be available to prepare for the training, conduct the training, and also for future support supervision visits to ensure the quality of TT surgery in the program. This training manual should only be used in conjunction with the WHO Yellow Manual, and it should never be used by itself. It is not designed to be taught through formal lectures, and strong support supervision should be ensured during all the training phases, especially during the live surgery activities to ensure safe and high quality patient care. Finally, the trainer should make use of the links and other technical resources provided to enhance the quality of the training. Thank you. Over to you, Sabrina.
Thank you, Amir, and good morning to everyone. Well, actually, as I'm based in Senegal, I should say instead, good afternoon to everyone. I'm very happy that I'm here today with you and that we have the opportunity to discuss together this manual. So before starting with this slide, I would like just to come back to one very important point that my colleagues already mentioned, and which is that ensuring the quality of training for TT surgeons, well, this is one of the key factors to increase the quality of surgical outcome. This is not something new. This was also discussed during the global scientific meetings in Moshi and Cape Town. Therefore, the main objective of this training package, because as we will see, additional support documents and training resources are included as well with this manual. So the objective is to facilitate and standardize the training process to ensure consistent quality of training for TT surgeons. Accordingly, and as it has been just said by Dr. Kello, it means that this manual is intended to help a trainer to lead, but also to prepare a training workshop for TT surgeons, and as well to monitor the learning gain along the process. So let's start. First, just a note regarding the general structure, as we already discussed briefly the points above. The content of the course has been divided in different sections, 6 in total, and each section includes several sessions. For each session, you will have the same structure, so you will find a summary of the session, its objective, the duration, materials, and out training procedure and tips. So here I would like to show you first a snapshot of the table of contents. And as you can see, before the section actually starts, there is a first part that targets the trainer with topic related to the preparation of the workshop, but we will discuss this further in the next slides. Then you can see the different sections and the related session. You can see also an example of one of the sessions. Well, actually, sorry, yeah. This is the first session of section 2, and you can see the structure with a summary, objective, duration, well, as we just discussed. So what are the plus of this training manual? The first point underlined with this slide is that the manual is designed to facilitate the application of adult learning principles, with as final objective to optimize the learning process for the participants. For example, the manual starts with the guidance for the trainer on their role and responsibilities linked with adult learning principles, which is actually also an opportunity to provide a refresher and so to ensure that each trainer has at least a basic understanding of this key principle and training approach. Then each section uses a combination of training methods adapted to the different learning styles, such as demonstration, discussion, role play, quiz, video, etc. And I think that we have all seen trainings conducted as formal lecture with no or very little interaction with the participants or no discussion promoted between them. And we know that this is not an efficient method to conduct a training. So in order to support the trainers to conduct an efficient training, a training that will optimize the impact on learning, and so a training that will fit adult specific needs, the different sessions are built in such a way that promote the application of adult learning principles. Then the next point, the manual is designed to be practical. So as we said, this manual is intended to provide guidance to the trainers to conduct the training, but as well to prepare it. And so, for example, the first part of the manual also includes a trainer checklist that should be completed before the course starts. This checklist summarizes the items required to prepare the workshop. On the right side of the screen, you can see a snapshot of this checklist. These items are related to the training materials, support documents, or the supplies needed, or to the logistical arrangements. And there is also reminders of trainees' selection criteria, and a note on the certification process is also included as well. Then, and still with the objective of being practical, tips are provided at the end of a session. As you will see in the manual, many sessions include tips. They can be related to the training process or to the training methodology. For example, it can be a guidance on how to use an icebreaker during the introduction session, or to what other sessions the current topic should be related to. In the example provided with this slide, you can see the tips section in blue at the bottom of the page. So here the topic in the example is social mobilization, and the tips emphasize the need for trachoma service to be inclusive. Actually, we know that most of the beneficiaries of TT services are women, but also the elderly or person with disabilities. And the trainer is here advised first to link the session with the previous session on women and trachoma, but also the tips provide an opportunity to discuss the concept of access to services and inclusiveness, and thus the need for social mobilization strategy to be tailored to ensure that our main beneficiaries are correctly targeted. In addition, these tips can provide further technical guidance based on field experience and on the common mistakes observed in the field. And I think this is a very useful point to highlight because this tip section actually also provides an opportunity to share some of the lessons learned during field implementation. Training tools. So we say that actually this is not only a training manual, but this is a training package. Just let me put the text. And several support documents and tools are included. Sorry. Just 1 minute, I go back to the proper slides. Okay, so several support documents and tools are included in Annex, such as a list of key messages for counseling, infection control and standard precaution, epilation counseling and training guide. And there are also other documents to support the learning process included, such as leaflets that can be distributed to the TT surgeon. For example, there is a surgical checklist that was developed, or a photo of immediate expected outcomes that are provided, or a leaflet summarizing infection control and standard precaution. On the right side, you can see some examples either of the support document included or some of the leaflets. Still regarding the structure of the manual. So we have used a competency-based training approach to support concrete skills learning process. As we said previously, the learning course has been divided into 6 sections, with each section presenting a specific competency, for example, related to pre-surgical skills or to the preparation for surgery. And what we did is that a sample of testing is provided for each section. These tests are not designed to be too much scholar or to be a formal assessment, but they are intended to foster discussion. And they use different approaches. For example, one test is done as a quiz, others are based on group discussion, etc. So this will allow the trainer to recap, but also to discuss any potential issue or misunderstanding, and so to ensure the learning has been optimal. The last point I would like to underline is regarding the content itself of the manual, and especially the sections related to aspects of surgical quality assurance. So the first point is related to infection control and healthcare waste management. And this is a basic but critical aspect to ensure surgical safety and quality. However, we know that often in the field, issues are faced and that infection control procedures are not yet systematically implemented. So in the manual, we put a strong focus on this critical aspect, and a specific session is dedicated to infection control and healthcare waste management. Key principles and objectives of infection control and healthcare waste management are reviewed, and the session is used to emphasize the importance of proper infection control and waste management procedure to ensure a safe surgery. The second point is related to post-operative cares and outcome monitoring. So the manual details complete post-operative cares and follow-up, but there is also an interactive session included that helps the trainees to recognize and discuss poor quality outcome of a TT surgery. For example, during this session, there is a set of photos that was developed by Emily Gower, which is used to show different examples of poor surgical outcome. The trainees are asked to identify the complications shown on the photos, and the trainer can use this exercise to conduct further discussion on post-op complications. So finally, to summarize, this training package includes a training manual, a suggested agenda, training support material and tools, evaluation forms, links to key resources, a PowerPoint presentation set slides, videos that are included in this PowerPoint, and support document to be distributed to the surgeon. Thank you.
Thank you, Amir and Sabrina, for the thorough review and presentation of the training package. As a reminder to participants, you can send questions throughout the webinar using the questions tab, and we will do our best to answer as many questions as possible at the end of all of the presentations. Following on the heels of the discussion regarding high-quality training for trichiasis surgeons, we will now shift the focus of the webinar to the tracking of patient-level information for those who receive surgery. We are joined today by Sarah Bartlett and Kim Jensen, both of Sightsavers, to discuss an innovative tool used precisely for this purpose. So over to you, Sarah and Kim.
Great, thank you, and hi to everyone. Thanks again for the introduction and opportunity to share more about the TT Patient Tracker. I'm going to start by giving some background before we dive into the specifics here. So let me see if I can get control. There we go. So we've identified 3 major challenges in TT outreach, which most of you on the call will certainly recognize. The first is ensuring that we actually complete the 7 to 14 day and 3 to 6 month post-surgery follow-ups. And as you all know, the 3 to 6 month follow-ups are especially difficult to organize and document. The second is the need to better evaluate surgeon performance, helping them and the teams they work on identify where more training might be required. And finally, there's a need for more timely activity reports from the field, so those will help programs plan future outreach, and they're also, of course, necessary for donor reporting. So many partners and projects in the past have recognized this and built various technology tools to try and fill the gap. However, as we all know, building technology is expensive, and a system required for complex activities like TT outreach is pretty time-consuming to design and build. So that complexity also comes into play on this next point, that most of the tools that were being built only concentrated on one area of outreach or only collected summary data. There wasn't a single tool tracking patients through the TT surgery and follow-up process. So finally, some of the tools being used in the field were starting to overlap geographically, meaning that surgery teams were being trained on and then asked to use separate tools to collect data, which is not the best use of resources, clearly, and had the potential to frustrate some already very hardworking surgery teams. So because of this, the World Health Organization coordinated a consultation in 2015 to agree on some basics of what a universal tool could look like. So an in-depth report was actually published after that meeting, so this is a very, very condensed summary version of that. So it was agreed that any tool should be smartphone and tablet based, that the technology itself should be offered free of charge to country programs, though as noted below in the slide, implementation costs would still be covered by programs. Any tool would need to incorporate standard TT surgery forms already in place, so most specifically the ICTC patient record card. It would need to provide necessary data for program planning. And finally, it would need to be a secure system, even more so because patient data is involved, and all data would be owned by ministries. So to start work on designing the actual tool, we did field visits in both Malawi in December of 2016 and Ethiopia in February of 2017. And on both of these visits, we were looking to really understand how a tool like this could be used in the field, focusing on how we could incorporate use into outreach camps, follow-up activities, and static sites. We looked at what the order of data fields should be and what skip logic we might want to incorporate to make sure the process of capturing data was as easy as possible for surgeons and recorders. We started tackling the big questions of who needs what reports and at what frequency. And finally, we looked at what kind of management would be necessary in country to make the initial rollout and then use of the tool a success. So during these initial assessments, we were actually just using a set of mobile-based surveys, which was fine to collect the data, but did not allow for tracking of patients over time. So this meant that surgeons and recorders wouldn't be able to access patient history on their phones, and that reports would be really complex to design. So we decided to move the tool at this point over to the ComCare platform, which has this type of functionality already built in, and we needed to just configure it for our own purposes. So I'm going to give you just a few of the basics of what we developed before I hand it over to Kim to go into more detail on it. So it's an action-oriented application that allows programs to collect patient information at different intervention time points for each patient. So those intervention points are registration, evaluation, surgery, and follow-up. This can be used offline and data uploaded when teams have connectivity. So surgeons have access to all patient information within their designated coverage area, allowing them to provide improved care and properly document interventions. That is also available offline if teams don't have connectivity at a camp. The information collected is then used to create patient follow-up lists, surgeon performance reports, and activity reports that can be used for programmatic decision-making. The system itself is HIPAA compliant, which is the security gold standard for medical data. And there are very strict permissions on who can access personally identifiable information. And finally, there's no centralized data management like there is in a system like Tropical Data. So national programs have full oversight and control over all data collected. So I'm going to hand it over to Kim now to give some more details on the tool itself.
Thank you, Sarah. Okay, so now we want to give you a closer look into some of the specifics of the TT tracker itself. We're going to show you some screenshots throughout, and I just wanted to have you note that some of the screenshots may not incorporate the most recent modifications as we continue learning as we're testing in the various areas, but it will give you a good idea of where we are with the development. And also you will maybe see any information on there. Those are not actual patients, so we're not sharing any identifiable information in these screenshots. So if we look at this first screenshot here, this is what we call our form screen. The TT tracker is form-based, so you'll have, when you log into the app, you'll have a list of forms, and we've tried to incorporate all of the similar forms that you find in the ICTC paper forms. We'll go through all of these in detail, but what a user will be able to do is scroll through the list and select the form they'll need for that specific outreach activity. Okay, so you may have seen this form at the bottom of the form screen. This is called our surgery session. It's at the bottom because it is not used as much as the other forms, but it is very important as it is required to open a session before any surgery activity is conducted. So you can consider a surgery session to be an outreach event or a surgery site for a given period of time. So a session may be a static site that lasts a month or an outreach camp that's 3 days long. All of those would be sessions. And we create sessions so that we can register a patient to a session, and we can then calculate how many surgeries were provided during that given session or outreach event. So when a user opens a session, they'll select the date, the type of session that it is, the district that it's taking place in, and then the user will be asked to assign a site name, which will go along with the session ID. This will help other users or the other surgeons and assistants in that session or outreach activity to easily recognize it so that they can select it in order to register patients. And we'll discuss the patient registration in just a moment. But once that's opened, all surgeries and registration, or excuse me, all registrations will be added to a session. Then when the outreach activity is finished, the session will be closed. And ComCare can then calculate all of the surgeries done during that outreach activity to show productivity. One thing that is not reflected in here is that we are able to also collect GPS points if enabled on the phones, so to have a better location for where the activity took place. So I know that there's a lot of information on this slide, but I wanted to show you all these two forms together, because though they're individual forms, they can be completed consecutively. So a user would be able to go into the registration form, complete the registration, and continue directly into the evaluate patient without going back to that form screen we previously discussed. So if we're looking on the left side here on the register patient, you'll be collecting the demographic information that you think of during a patient intake. You'll see the name, age, sex, residence information, and if available, contact information for the patient. So as we discussed, there's a list of sessions here now created, and in the previous slide, we created the AATV1. So the user can scroll through the list of open sessions that have been created and select the appropriate session, or use the search capabilities to search for the session and then select it from there. When all of the patient information is entered, the patient will be given a unique patient ID produced by the phone. The evaluation information on the right side will include the screening information used to assess a patient suspected of TT. So if we look right here, there's a right eye specific questions. And in order to streamline the activities required of screeners, surgeons, registers, whomever is entering this information, they'll be asked if a patient's eye is suspected of TT. If that eye is not even being evaluated and not suspected of TT, they will be able to skip those subsequent questions, so they will not have to answer unnecessary questions. The screening information that's included, you'll see in these screenshots, is what you would see on the paper forms. So you'll see how many eyelashes are touching the eye, if there's evidence of epilation, evidence of scarring, so on and so forth. And then there will be for each eye a recommendation or action required for that given eye. So you'd have offered surgery, recommend epilation, and what's not visible on this screenshot, there is a referral selection or other management. In the case of referral and other management, there will be a follow-up question that will allow the user to enter more details about the referral or other management. Once a patient has been registered and evaluated, the surgery will be recorded. So the same process as you would do for registering a patient, for example, you would go to this form list, select record surgery, and this time, rather than getting that list of sessions to which to add the registration information, this now will be the patient list to where you want to add the patient or the surgery record. And again, you are able to either scroll through the list, or if there's many patients, you can use the search bar at the top and search either by name, ID, or session ID. And what a portion, if you write just a portion of the name, that will also appear on the list. Once the patient is selected, there will be a quick summary list to ensure that you have made the correct selection for the patient that you need. So I've included many screenshots down to show you what the actual app looks like. But in general, we're collecting the same information that's on the paper forms. You'll see that we're asking for surgeon performing operation, operation method used for surgery, surgical complications, type of suture used, and if antibiotics were given. But if you look down here, we have our pre-populated surgeon list. So this is a list that is maintained within the ComCare system and kept up to date so that a user can easily assign the surgery to the correct surgeon. If the surgeon name is not on the list, it is possible to enter that name manually, but of course, based on spelling inconsistencies and for analysis purposes, it's much easier to have that list up to date so that you are consistently selecting the correct surgeon. There are many questions throughout here that are individual to each eye. So if an eye is not recommended for surgery, and this is following the evaluation form, there will be a message that comes up that says that that eye was not recommended or accepted for surgery, so that the user will not incorrectly document a surgery for that given eye that was not recommended. Once a patient receives surgery, they need to be followed up. And we've created the forms for all 3 time points of follow-up, the 24-hour, 7 to 14 day, and the 3 to 6 month follow-up time points. So same rule applies before. The user will select from the form list, which will lead this time to the patient list. They can use the search bar to search the patient. Once the patient is selected, the user will select the type of follow-up that needs to be completed. This is a summary form, a patient card that will appear for surgery and any of the subsequent follow-ups. And it will include all of the information entered to that point in time for that patient. So in this case, it's the day 1 follow-up. So the information on this patient card will be the registration, evaluation, and surgery information so that the person conducting the follow-up will have the full picture of that patient while they're doing the follow-up. And what we're collecting here is the same what's on the paper forms: surgeon performing follow-up, follow-up location, surgical complications and outcomes, and any actions that were required based on the evaluation. And one thing that's not on here but is relevant to the follow-up forms is the due for follow-up lists. You may have seen that if you glance quickly at the form screen at the beginning while I was talking. The due for follow-up lists are a pre-populated lists that are calculated based on the surgery date for that patient. So it will allow users to look at their phone and see within their coverage area at a given time how many people or who is due for the 24-hour follow-up, for example. Once that person's follow-up is completed, they will be removed from that list. If they're consulting that list, they will not have to go back to the form screen to complete this follow-up form here. What will happen is from the due for follow-up list, it will lead directly into the given follow-up list. So if somebody is consulting the 7 to 14 day follow-up, the due for 7 to 14 day follow-up, then once they select the patient and choose to complete the follow-up form, it will lead directly into the form and we'll skip this selection process here. And similar to the due for follow-up lists on the phone, there will also be due for follow-up lists that are sent as an automated report via email to designated supervisors. This will include lists for patients who are due for 7 to 14 day follow-up and 3 to 6 month follow-up in a given area. This will be attached in Excel so that users can download and manipulate the file as needed for program activities and planning. So with the emailed follow-up list and the phone version of the due for follow-up list, we do hope that the challenging collation of these follow-up lists, having to use the paper forms, may be a little bit easier. Using the tracker will also allow us to do more frequent assessments of surgical outcomes. So this is an automated report sent to designated individuals and will show the monthly and year-to-date totals for surgeries completed by each surgeon. And it will also show the year-to-date and follow-ups completed and outcomes for that surgeon. So with the this will help programs to see the progress of the surgeons even if they're not conducting a surgical audit, and perhaps will help determine where surgical audits need to take place. Another thing we wanted to do with the tracker was to find a way to make surgeons feel more engaged in the elimination efforts. So we've created an optional emailed report for surgeons who have email addresses. And this monthly report will contain summary surgery information, which includes national numbers of surgeries for the month and the year, so that each surgeon can see their contribution as a greater, as the entire nation. And then also their individual outputs and outcomes so that they can track how they're doing and to see their own work. And we hope that this will engage the surgeons so they do feel a part of the bigger program. And the last thing I want to discuss is a data visualization tool.
So we seem to have lost sound from Kim.
Sorry?
We're going to try and get her back on the line in just one moment.
Can you hear me?
Yes, please go ahead.
I've been able to hear you the whole time.
Okay. So, I'm sorry, Emily, you said you could hear me the whole time, no need to go back?
Correct.
Okay, great. So this is the data visualization tool that we're also developing. So this would allow programs to easily work with their de-identified data to get summary information in table form or in graphs or in charts, and they can limit that to designated areas or time points without having to do any fancy coding. So what we're looking at here is just a piece of what's called the dashboard, and they're established queries that are put on the main page so that programs can see a snapshot of the progress of their activities. And these are just examples that we put on to demonstrate the dashboard. We are working on new queries for program dashboards. Oh, come on. Okay. And this is another section of the dashboard, just showing another variation that may be visible. And this would simulate an Excel report. So this is the summary for the entire area, and then it can be limited here. I've selected to limit it from a date and it breaks it down immediately into those who have information relevant from that time point on. And then in addition to the summary dashboard, there will be predetermined queries that can be saved to a project. So if there's data or analysis that's frequently required for a program, they can save it and easily go in and select that query and get the up-to-date information. So these are just examples, but we'll use this eye counts here. And if you select eye counts, this query will pop up immediately, and it will show the total eyes operated in which location and what those decisions were for each eye. And then you can select to limit it to a specific district, and it will do the analysis immediately for you and do those calculations. So we're excited at the potential for this and allow people to use the data and not have to spend so much time doing the analysis themselves. And we'll show all of the work that everyone's doing right in front of us in a pleasing way. So I'm going to hand it off to Sarah to talk about next steps.
Great, thank you. Let's see, yeah, we just had a few more things we wanted to cover before we're done. One is on the support package. So in an effort to help countries roll out the tracker, we're developing a support package that will hopefully help with everything from planning to training to data management. So we have the TT Tracker overview presentation and a condensed 2-pager, which are both good ways to share the basics of the system with ministries and partners. There's a data security and compliance FAQ to answer more in-depth questions about data privacy and storage. There's an implementation guide, which includes budget templates, phone purchase decision-making templates, data definitions so reports are clear and transparent, and a roles and responsibilities overview to ensure the right people are engaged in managing the tool. There's a user manual, including phone setup and maintenance, and web and mobile data entry guides for field staff. And there's further documentation on how to upload and modify users and how to edit data in the system. And finally, we're developing a suite of training presentations that countries can use to train their various levels of staff. Oops, there we go. We also wanted to quickly break down at a higher level who will be responsible for what as countries begin using this tool. So countries will not have to pay for the application itself. The application, storage, and reporting functions will be all free of charge. The support package from the last slide will also be available to countries. And finally, though we're still working on exactly how much support will be required, we do plan to offer ongoing support for questions which are not answered in existing materials, and also be available to lead training sessions. So countries will be responsible for all costs around phones, data, and training. They'll need to cover any printing of manuals and training materials. They'll have to actively manage users in the system, so that's including their roles and locations, so every user receives the right reports. And they'll also need to keep that list of active surgeons up to date in the system. And finally, some countries may want to enter surgeries done within the previous 6 months, which have yet to receive follow-up, so they can begin using that follow-up report functionality as soon as possible. So if they decide to do that, they'll need to engage someone to enter those surgery events into the system. Oops, went too far. Oh no, now we're really too far. Sorry. So quickly on our rollout plan, Nigeria and Tanzania are currently using the tracker at a small scale. Nigeria began in November of 2017 and Tanzania in January of this year. So our plans over this month and next month are to evaluate the current rollouts, making any final changes and enhancements, and thus create what will be version 1 of the tool officially. And then we'll make it available to other country programs. So the goal is to do that by April. So although most of this is good news and we're very excited about it, we are aware of a few challenges, some of which we've already discussed a bit, but we want to make sure countries are thinking about these things early. So first, that it's going to take dedication from high levels in every country to ensure the tracker is used. Second, that adequate budgeting will be required to cover the costs of phones, data, and training. Third, that because the TT tracker affects program activities at all levels, it may take teams time to adjust to the new system. We just need to be aware of that and remain consistent. And lastly, as we mentioned earlier, the ministries and their partners will have to maintain an up-to-date list of surgeons and ensure the right individuals are receiving the right reports, which will require very consistent engagement with the application. However, we're feeling very confident that countries implementing the tracker will find real benefit in it, and that it has the potential to improve patient care in our TT programs, which is really the most important thing of all. So thanks, and please get in touch with either of us at any time. Thanks for listening.
Thank you, Sarah and Kim, for the clear overview of this exciting new tool, and apologies for the unexpected technical glitch on our end. I'd like to once again thank all of the presenters and would invite those of you participating in the webinar to ask any questions you may have of any of the presentations made. As a reminder, just click to the right-hand side of your screen and use the question box in the GoToWebinar platform. So we have our first question. It's come through and it's regarding the surgeon training package. So when will the Trichiasis Surgeon training package be available and in what languages?
Do you want to direct individuals to who should answer them?
Yes, Sabrina, are you on the line?
Yeah, okay, thank you, Whitney. So the TT training package is now finalized. It has been reviewed extensively for the content by many persons. I think I will forget someone, but it has been reviewed by Sheila West, Martin Coleman, Paul Cotright, Anthony Solomon. Oh, yeah, I'm sure I forget somebody in the list. However, the manual is now with ICTC. It's on the final stage of branding and marking, and it should be available soon, I think within a month. And it will be available in English, but also in French.
Thank you, Sabrina. The next question is one regarding the operationalization of the TT Patient Tracker app. So to Sarah and Kim, does every active surgeon need a phone?
Kim, I'll grab this one. So no, thankfully they will not all need a phone because that would have been rather expensive. So because there's a drop-down list of surgeons on every phone, we'll always know who's performed a surgery even if each surgeon hasn't actually been assigned their own phone. So that takes away that limitation. So we expect that phones are going to be pooled and probably only distributed immediately before surgery or follow-up activities. So of course, the amount of phones needed will vary across programs, but we're estimating that each camp will require 2 to 3 phones while it's happening. So in the end, it really depends how many camps are happening simultaneously in an area. So it's more about level of activity and not necessarily number of surgeons in your program.
Thanks, Sarah. While you guys are on the line, there's another question that's come through for you. How can the ministry and supporting partners access a patient's record if there is a complication?
Okay, I'll take that one then, Sarah.
Okay.
So all of the identifiable data is stored in ComCare. So there are 2 ways that we're working on to access this data. Within ComCare, they have specific reports that can be run, including the identifiable information. So one of the approved reports in the ComCare app itself, users will be able to go in and select that designated report that could be created, for example, as the patient line list. And if they need to filter it down to a specific patient, they can do that, or it can be exported into Excel for further use. The other option is that ComCare itself has basic exports that can be done. Now, this can be any of the information that's collected in ComCare can be exported using these, downloaded using these exports. So a user could go in and select one of the predetermined exports that have been established that include only specific information. So there may be a patient line list export that is established there, or they could go and take the entire list and download that and manipulate it that way. or they're also able to go in and select just the variables that they would want to export and then export it that way. And all the patient information can be exported as well from there.
Thank you for that explanation, Kim. There's a couple people asking a similar question regarding the application, and that is, how many languages will the app be translated into, specifically with a shout out for our Francophone colleagues, and
yes,
whether or not it will be available in French?
Yeah, so we do have plans to translate the app into French later this year with the help of MMDP, who will hopefully will be using it. And as more countries come on and we can continue translating it into additional language. So there's no technical limitation on how many languages we can translate it into. It just really depends on need and how much support we can get from other programs to help us do the translations. And of course, we'll also want to translate the majority of the support materials so we can give a thorough package to any countries. But sky's the limit. As long as we have countries wanting to use it, we can translate it into as many languages as we need to.
Okay, thanks, Sarah. So I think we have time for just about one last question. So over to Sabrina. There's a question regarding specific examples from field experience that was used in the testing of the manual that was used to help develop the final version.
Okay, all right. Thank you, Whitney. And Amir, please jump in to share also your experience here.
Please go ahead.
So first, just a reminder, this manual was developed based on the yellow manual and also on the preferred practices that are based on evidence. Then, because our objective was also to have a practical manual, we added a section based on what was observed in the field during supportive supervision visit, based on the common mistakes that were observed. For example, the first one that comes into my mind is related to infection control and healthcare waste management. And what we did is, okay, to add a section to emphasize what are the key principles, what should be done, but also keeping in mind the reality in the field. There is also tips that are provided to highlight what could be acceptable alternative when there is a material that is missing. Amir, do you want to add something?
Yeah, well, this experience from the field basically looked into what is happening in programmatic and under programmatic conditions during TT surgery activities in the outreach in different countries. You know, as trainers, we shouldn't be taking things for granted, like, you know, how to put on gloves properly, but also, you know, how to examine a patient properly. Although it is described in the yellow manual. When you actually see people doing the work in the field, you see some challenges. So we put in those observations into the tips section, basically.
Okay, thank you, Sabrina and Amir, for those responses. So on that note, we're going to wrap up the end of the webinar. I'd like to once again thank the presenters, Emily Gower, Amir Bedri-Kello, Sabrina Latour, Sarah Bartlett, and Kim Jensen. We'd also like to thank you all for listening in and for asking your questions. We received quite a few that we were unable to get to, but we will be sharing those questions with the participants, with the presenters, and then we will share the responses with those that have registered for the webinar at a later date. So thank you very much for your active participation and engagement. We will also send a link to a recording of the webinar, as well as the accompanying presentation to those who are registered, and make them available from the MMDP project website. We would greatly appreciate you taking a few minutes to complete a questionnaire that will be auto-generated at the end of this webinar to get your feedback. So with a final thank you, we will end today's webinar.